the Global Surgery Lab presents an open chest tube insertion crash course. A chest tube should be inserted to drain gas, blood, or fluid in the pleural space. Some examples are listed here. To perform an open chest tube insertion, first prepare your supplies and patient. Then landmark your incision, followed by puncturing the parietal pleura and dilating your incision. Then insert the chest tube, and finally securing the tube with a thick suture. To prepare your supplies and patient, you will need a knife, Kelly forceps, chest tube, and thick suture. As always, remember to follow all safety and best practice protocols. Position your patient supine with their arm raised above their head so you have good access to the mid-axillary line. Note that we have not raised the cadaver's arms above their head in this video. To landmark, find the fourth intercostal space using the nipple. The fourth intercostal space is bordered by the fourth rib superiorly and the fifth rib inferiorly. Your incision should be made along and superficial to the fifth intercostal rib, just anterior to the mid-axillary line, so that the patient does not lie on the tubing. Your incision should be just long enough to accommodate the tubing and clamp, and should cut through the full thickness of the skin. Next, use the Kelly forceps to puncture the parietal pleura along the superior surface of the fifth rib to avoid damaging the intercostal neurovascular bundle. This might require some force, and you should feel a pop as you puncture the pleura. With the tip of your forceps in the incision, open your forceps as wide as possible to dilate the incision. You may use your finger to ensure that the lung is not adherent to the chest wall and further dilate the incision. We ensure that the chest tube is first clamped on the proximal and distal end to prevent splashing of blood. Then, we insert the chest tube into the pleural space, guided by the Kelly clamp. Aim the tubing posteriorly and towards the apex of the lung to avoid getting caught in the lung fissures. Once the tubing is through the incision, remove the Kelly clamp and twist the tube deeper into the pleural space. Once the tubing is in place, secure the tubing using a large suture. Ensure the tubing is positioned posteriorly in the incision. Use a horizontal mattress suture to cinch the incision closed around the tubing. Ensure there is a good length of suture material at each end of the suture so that you can wrap the ends of your suture around the tubing as it exits the incision. You may use hand ties or the figure 4 technique as shown in this video to secure the tubing to the skin. Finally, when your chest tube is secure, connect the tubing to a collection system. Use a Heimlich valve and collection bottle with a water seal. In conclusion, an open chest tube can be inserted to drain fluids or gases from the pleural space by first preparing your supplies and patient, landmarking your incision properly, blunt dissection, then inserting the tube, and finally securing your chest tube with a thick suture.